Namaskar. Myself, Professor Dr. Chira Ranjan, Head of the Department Radiation Oncology, Some Ultimate Medicare, Bhubaneswar. Today is 31st May. 31st May is observed as a No Tobacco Day. So the main motive for this is to create adequate awareness among the public regarding the harmful effects of tobacco and how somebody can quit the tobacco and lead a happy and fruitful life. Tobacco contains generally more than 200 different type of hydrocarbons, and hydrocarbon chemically it is almost same with that of the genetic material, something called deoxyribonucleic acid present inside the human genome or inside the cell. So that tobacco gets integrated, that is able to cause enough damage in that genetic material present in the human body, which gradually transforms into a cancerous cells. So in a simple way, prolonged use of tobacco causes enough damage in the genetic material present in the human body that transforms into cancer, not only in a single organ but also in different type of organs like oral cavity, the throat, the voice box, the airway or air pipe, the lungs, which generally purifies the air, and stomach means where the food goes and stays for the digestion, colorectum means the intestines, urinary bladder, pancreas, almost all, each and every organ is involved in cancer due to the tobacco use, because tobacco contains that harmful material, hydrocarbons, heavy metals, that gets circulated, that gets involved or dissolved in the blood, that gets circulated throughout the body and is able to create many type of cancers. Not only cancer, other also chronic disease like chronic obstructive pulmonary disease, where the human being is unable to breathe in and breathe out, that causes many symptoms like prolonged cough, cough related sleeplessness, cough related stress, cough related chest pain, and in extreme cases sometimes bleeding from the mouth, and the blood vessels which carry the blood, that gets jammed, that gets clogged. So that causes damage in the heart, something we call as a heart stroke. And if that blood flow gets restricted to the brain, we generally call it as a stroke or paralysis. Similarly, many type of problems happens in the pancreas, in the intestine, in the urinary bladder. So in a nutshell, tobacco is not at all required for a human body. If we see as a common man, if we see a tobacco plant, ordinary insects like honeybee or any butterfly, they never gets attracted or towards the tobacco plant, they never consume these tobacco flowers of the tobacco plant, they never sit on that. If we see our ancient practice, we usually keep tobacco leaves inside the rice or the dal in order to prevent any type of worm infection or worm infestation, to preserve that rice or to dal for a long time. So basic motive behind this is insect hate tobacco, but we are human beings much superior than the insect, but still we consume tobacco.
Sir, what type of cancer are most commonly associated with tobacco use?
Out of total cancers, almost 40 to 60% cancers are due to tobacco use. So the first is the lung cancer, because during tobacco smoke, the smoke goes into the lungs and causes repeated damage. Second most common cause of the tobacco use is the oral cavity and throat cancer, because the smoke or even smokeless tobacco like chewable tobacco like pan masala and different things, that gets deposited in the oral cavity, that gets deposited in the throat, and that causes persistent irritation, persistent damage, and transforms into tobacco. Less common areas are the pancreas, urinary bladder, stomach, intestines. So these are the organs generally affected with cancer, and that affects the quality of life.
Sir, can you please explain the difference in cancer risk between smoking tobacco and chewing tobacco?
Definitely, there are multiple risks of having cancer, and both in the same weightage, means smoking versus non-smoking or something called smokeless tobacco like pan masala and all, betel nut chewing, pan masala chewing, both causes equal proportions, equal incidence of the tobacco related cancer.
Sir, are passive smokers at equal risk of developing cancer?
Yes, because passive smoke means something technically we call it as SNS, means second hand smoke. So if somebody smokes in a closed room or closed compartment like bus or train or in office, so the persons who are nearby to the smoker, they also inhale that smoke. So the same smoke also goes to other person's lungs, other person's blood, and they also causes enough damage if second-hand smoke is exposed to a long time, and that causes cancer.
Sir, what are the early warning signs of tobacco-related cancer?
So the first thing, if somebody smokes for a long time, the first symptom usually happens in the lungs, means he starts coughing, something called dry cough that causes chest pain. That cough sometimes disturbs the sleep, and sometimes that tobacco smoke causes clogging or the obstruction in the blood flow of the heart and the brain. Sometimes blood pressure happens, sometimes palpitations means abnormal chest beating, sometimes stroke or paralysis happens due to the decreased blood flow to the brain, and sometimes peripheral vascular disease means numbness or weakness in the fingers and the foot. So these are usually the early symptoms of tobacco related disease which are generally not cancer, but if consumed for a prolonged time, then cancer symptoms gradually starts.
Okay. Sir, how effective is early screening in preventing tobacco-related cancer?
It's extremely useful, it is extremely needed, because it has been seen that if somebody stops smoking within one day, the oxygen saturation level in the blood that improves. Within 3 to 4 days, the lung function starts recovering. Within 5 to 7 days, the blood pressure gradually becomes normal. Within 1 year, the lung function becomes almost normal. Patient does not feel fatigue. Patient does not feel means the urge to cough out, choking sensation during the inhalation or airflow. So that decreases within 10 years after tobacco cessation or smoking cessation. The chances of having a lung cancer becomes decreases by more than 50-60%. So tobacco cessation, smoking cessation definitely helps.
Sir, what role does a diet or a lifestyle play along with quitting tobacco in reducing the cancer risk?
So good question actually. So if we are able to distract the mind from tobacco consumption, from tobacco addiction by consuming good quality tasty foods or engaging some in physical activities like exercise, running, or playing a musical instrument, or reading a good book, or watching a good movie, or staying with the relatives, family members, that generally distracts the mind from tobacco use, that gives another type of happiness, so that stops the tobacco consumption.
Reverse some of the damage by quitting.
Definitely, slowly body starts recovering, just like I described. Within one day the lung function improves, the oxygen saturation improves. Within 3 to 5 days the blood pressure starts coming down. Within 1 year the lungs almost becomes normal. Within after 10 years the probability of having a lung or throat cancer decreases by more than 50%. So this happens slowly body starts recovering from that tobacco related damage. But yes, it is not 100%. That's why public awareness is required. People should know that an insect never consumes a tobacco, like a honeybee or butterfly never consumes a tobacco. So we are human being much better than them. So why should we consume tobacco? Because tobacco causes irreversible damage. And thanks to the Pramaya English, a leading uh, public social media, so in news channel, so in creating this public awareness.
Sir, any suggestion or anything you want to aware people?
So I would like to request everyone Please choose life. Please choose happiness, not tobacco and tobacco related disease. There are multiple things which will give you pleasure, multiple things to do in your life, not so choose life, not tobacco.
Thank you so much, sir, for sharing such a wonderful things. Thank you.
Thank you, madam.